I went somewhere first other than pain care, and which I felt like was a disaster. And it's like I had told the girls, I feel like I've been in pain care hell, so I know what good pain care is. But my apprehension was, I worked with several girls that had neck problems, the same as I did, and back problems, and they had had surgery and were really suffering from it. So my idea was, I don't want to be like them, so I just kept putting it off. But then you get to the point one day where the pain is so bad, you say, I got to do something about this because I don't have quality life anymore. And what's quality life when you're laying on a sofa with a heating pad, or you're in bed with a heating pad? So that's when I made up my mind it was time for me to do something about it. The changes for me and the benefit for me is being able to walk again, to being able to actually drive again, being able to turn my head to the side instead of my body to the side in order to see if there's a car beside me. That's dangerous, but anyway. But the biggest thing is walking without the pain in my back and my hips. So now I can go shopping, I can go out on a trip with the family, and I can walk all day and I don't have that problem. I have found this to be the warmest, most receptive group of people that I've ever dealt with. I dealt with the public for 42 years, and I understand customer service, and I understand how you treat people. And I always was taught that you treat people the way you want to be treated, and that's the way they treat me. I'm a person when I come in. I'm not an ailment, I'm not a complaint, I'm not a burden. I'm a patient with a problem, and they treat me with respect, and they always have a smile, and I love that. In the past, when I've had pain care management before, it's like they throw some drugs at you, and they do an epidural every couple of weeks, every couple of months, or whatever, and they never get to the root problem. We did CAT scans and MRIs to to determine exactly what was wrong and what needed to be fixed. And I appreciated that instead of just guessing. I didn't like the guesswork. I want to know what's broke and how are we going to fix it. And they always tell me exactly what I need to hear, and I trust them, and I'm doing great. I started out at the Griffin office, and then they started coming to Fayetteville. Not that I didn't like the guy in Griffin. He was awesome also. He loved Las Vegas just like me. So anyway, I loved him. He was really sweet and really special, but I had a situation where I needed to see somebody fast, and they asked, did I want to see the Fayetteville office? And I said, yeah, it's only like 5 miles from my house. So that's when I first came. This is when I met Dr. Chang, when he started coming to Fayetteville, and I fell in love with Dr. Chang. I mean, he's just awesome. If he told me to stand in the corner with a bucket of water and with my head in it, I would feel better, I would believe him. So anyway, I just think he's incredible. I just think he's wonderful. You know, when Dr. Chang, when I have a visit with him, I know he's got my best interests at heart. And I trust him, and trust is the biggest element in a doctor-patient relationship. And I trust him explicitly, and I just wouldn't trade him for anything. Right. I find that a lot of people that complain about back pain and neck pain, they have this negative image of people in the past that had bad surgeries, you know, back before they did epidurals, and they've got friends that do this, and they feel real negative because they don't want to be that way. They don't want to compound a problem. And the biggest thing is just trying to convince them how much better off they would be if they came to a Dr. Chang, to let him, you know, find out what's wrong with them and give them a treatment option. Now, they don't have to do it, but just to come in and get an option and talk with him. I think once they talk with him and understand that it's not like it used to be many, many years ago. It's new and it's modern, and it's just so wonderful. I just can't tell them how much I appreciate this practice and what they've done to me. So hopefully some of them will come.